Hi, I'm Dr. Sivaghami. I'm a medical doctor now attached with Prudential Malaysia. I'm here to speak with you about standing strong against critical illness. I wish I could have seen you all face to face to do this talk, but as we are all aware of, social distancing is important at this point due to COVID-19. Everyone's concerned about COVID-19 as they should be because it has upended how we live, work and engage with each other. Importantly, it has also brought into focus what matters most and what needs protection. Nevertheless, it is a pleasure to engage with each and every one of you via the digital platform arranged by My Welfare. Critical illnesses are serious health conditions which has significant impact on the way of life, either physically, mentally, or even financially. Any such conditions that you can think of just top of your mind, like cancer, heart attack, stroke, kidney disease, all are critical illnesses. And it's important that we are cautious about it, as 9 out of 10 reasons of death in our country is due to critical illness. Did you know that 1 in 4 Malaysians are at the risk of dying from non-communicable disease before the age of 70? That's pretty alarming, isn't it? In fact, younger people are presenting with serious illnesses like heart diseases. Again, 1 in 4 heart attacks happen for people who are below 50 years old. Malaysia has the highest rate of diabetic in Asia and also labeled as the most obese nation in Asia. And almost 50% of our people have high cholesterol. Now, looking at these stats, we understand why non-communicable disease contributes to the highest number of death and disability in this country. And unlike the common thinking that these diseases are only happening to old age, we see more and more young people being affected by these diseases. The other common critical illness is cancer. Yes, the big C. Statistics show that 1 in 2 males and 1 in 3 females have a lifetime risk of developing cancer, while 1 in 4 males and 1 in 5 females run a risk of dying due to the disease. The top 5 cancers that we see among Malaysians today are breast cancer, colorectal cancer, lung cancer, cervical cancer, and nasopharyngeal cancer. Prevention is always better than cure. There is primary prevention, in which we do what is needed to protect us from the disease, and then there is the secondary prevention, in which we know that we have the disease, but we do what is needed to postpone any significant health event like a stroke or heart attack. In general, it is important that we lead a healthy lifestyle, eating the right diet, keeping active, getting sufficient rest and sleep, and to also practice mental relaxation techniques like yoga and meditation. Now, speaking about the right diet, we know that there are many types of diet out there. To speak of paleo diet, keto diet, intermittent fasting, etc. And we see a lot of people getting very confused and trying to make the right choice. And actually, there's no right or wrong in these. It's about finding what is right, one that fits you. But all these actually have a similar basic principle. Eat food closest to its natural form, cut down on the processed food, reduce the intake of refined sugar, and do not overeat. And of course, drink a lot of water. Exercise is a very important element as well. Your daily exercise quota can be achieved in many ways. Hitting the gym, going for a long, peaceful walk, playing physical games. Well, the goal is just to keep active. The simple start would be to ensure each day you complete a number of steps. It can be 8,000, it can be 10,000. And many people think sleep is not important. You probably are thought to think that sleep is the last thing you do when you have nothing else to do. Well, that is not true. Sleep is a very important element in staying healthy, both mentally and physically. So please ensure that you build good habits around your sleep, like going to bed right on time, setting the lightings and temperature conducive for you to have a good night's sleep, and aim to get at least 6 to 8 hours of good sleep. We are now in the digital era, and a lot of us are accessing digital health and fitness app to stay fit and healthy. For example, we use a calorie tracker to track how much calorie we consume, and probably a running app to see how many kilometers we run. Prudential is more than just about selling insurance. We are innovating the way we do business. We want to make our customers not just wealthier but also healthier. After all, health is wealth, isn't it? We have launched our health app, Pulse by Prudential, last year, August, to deliver affordable and accessible healthcare for all Malaysians for free. The health risk assessment in Pulse is a very comprehensive assessment. You are asked a set of questions to gauge your health status and risk factors. It is very important because with this information, you can take the right step to maintain good health. And it is simple to do as well. You interact with a chatbot, and after answering a series of questions, you get a report about your physical health, mood, nutrition, and lifestyle. And you also see a cool digital twin, a virtual representation of your health. With each steps you take towards improvement, you can see your digital twin getting healthier by the day. Now, that is exciting, isn't it? You can also track your exercise progress with a fitness tracker to track how many calories you burn by running, cycling, and swimming. There are many interesting features in Pulse. Just to name a few, AI Symptom Checker, which is an AI-powered tool you can use to check your symptoms to give you an idea what these symptoms might be telling you. And with that, it may also share some tips to monitor the condition or even prompt you to seek help with a doctor. And there is also an online consultation. Now, you do not have to get out of your house and from your comfort zone to see a doctor. You can do it just from the comfort of your home. And these are real doctors. They are running clinics out there, and they are serving our customers via Pulse by providing online consultations. The other unique feature that we have is the dengue prediction model. You can find out which area that you are visiting, or even the areas that you live in, and how many dengue cases there are, so that you can protect yourself and family when you are in that area. When critical illness strikes, there are a lot at stake. Not only for the person, but for the whole family and the loved ones as well. All the more so if the person is the breadwinner of the family. All of us might have heard of such stories. Things were just going on fine till one day a family member is diagnosed with cancer and things just changed overnight. There is high medical cost to pay for, and because of that, the whole family has to make sacrifices in lifestyles and sometimes even the children's dream and education. They have to choose a less expensive alternative rather than pursuing their dreams. Critical illness can cause financial ruins to families which are less prepared. In essence, being insured gives you the peace of mind knowing that you and your loved ones are financially protected in the event something unfortunate happens. You do not have to give up on your dreams or lifestyles. You do not have to be added on with a financial burden. You can focus only on the recovery. A common misconception many have is that if you already have medical insurance or are covered by your employer's medical insurance, it's not necessary to take a critical illness insurance. The lump sum payout from critical insurance could help cover the cost of care and treatment, recuperation expenses such as additional equipment, traveling expenses, medicinal supplements, and even pay off the debts if taken. It can also be used to cover any alternative treatment which medical insurance does not cover. At times, a critical illness can result in a loss of income either temporarily or permanently. Some people use this lump sum payout to help fund their home care, mortgage, basic living expenses, and keeping the entire household afloat. Basic medical insurance and critical illness coverage are different, and one cannot replace the other, but rather complement each other. There are a few things to consider. Firstly, how many critical illnesses does the plan cover? Prudential has a comprehensive critical illness solution called PruMy Critical Care, which offers financial protection against 160 conditions, one of the highest coverage in the market. Secondly, what is the age limit and other coverage requirements? PruMy Critical Care covers you up to the age of 100 for early, intermediate and late stage detection. It also provides protection in the event of re-diagnosis for the three most prevalent diseases: cancer, heart attack and stroke. Number 3. Are there any special coverages? PruMy Critical Care has additional special benefit coverage on diabetic-related conditions and joint-related conditions. Moreover, it also comes with comprehensive critical illness coverage that allows multiple claims up to 400% of the rider sum assured. So, while cliche, the saying health is ultimate wealth rings very true, especially in the current situation we are in. Prevention is always better than cure. So stay healthy, stay safe, and get financial freedom and peace of mind with insurance protection.